Hey guys, what's going on?
Hello, everybody. We're back.
My name is Nurse Renee.
I'm Nurse Jackie.
And we talk. So I always start the conversations off. This time, I think I'm going to let Nurse Jackie start it off because this is something that I think this particular subject today is something she's very passionate about.
I am.
And I think we'll start it with Jackie because a lot of you may actually feel like Nurse Jackie. So let's just let Nurse Jackie introduce what we're going to do for our second episode.
Okay. So today, we're going to be talking about is recreational marijuana bad for your brain? And as you know, those of you that listen, our last podcast, we talked about the effects of THC. And I just delved into it a little bit. And I said that on the next podcast, I will come back and have more to say about THC. So we found out that THC is that psychoactive compound that gets you high. That's the part of the marijuana that gets you high. And of course, I said that it affects your brain cells by literally killing them. Yes. And you have to pull on the other neurons, or the neurons, which are brain cells, have to pull on the other good ones so you could function. And so that's where we were with that. So with the recreational marijuana, I don't think it should be legalized. And of course, I believe it's bad for you because I looked up some things here and I went through some studies. It says that it could affect your mental health, and sometimes it can leave you anxious, afraid, panicked. You can start having those panic attacks. It can raise your chances of clinical depression, or it can worsen the symptoms that you already have, or any mental disorders. If a person is dealing with any mental disorders, it can actually worsen those symptoms. And so that's why I believe that it is not good for you. I went on WebMD. I was trying to get WebMD. Actually talked about marijuana being bad for your brain, and I looked at some articles here, and it talked about the same thing with the THC, saying that marijuana, or as you know, is weed, pot, dope, grass. They're different names. I'm sorry about that, guys. So the different names, you can either, it all comes from the cannabis plant. As you know, you can smoke it, vape it, drink it, or you can eat it. But it says that most folks use the marijuana for pleasure and recreation. But there are a growing number of doctors that actually recommend it, because you can't prescribe it, but they recommend it for specific medical conditions. So even though they do that, you can get high from it. The THC, it stimulates the part of the brain that responds to pleasure, like food and sex, and it does release this chemical called dopamine, and that's what gives you that euphoric and or relaxed state. But the THC, those levels, they literally destroy those brain cells, and it can heighten your senses, it can lower your senses, you can get hooked on it, you can become physically dependent on it. Your body can go through withdrawals, leaving you irritable, restless. Sometimes you can't sleep. Sometimes, although I hear people talk about having the munchies, sometimes it leaves you unable to eat. So when you use it, just understand that it's addictive, and that for one thing, it destroys those brain cells. You can have problems with learning disability, memory problems. Some people have tested to have lower IQ scores. It causes your lungs to hurt. It's a myriad of things that THC does that I feel is just not good for you. So I'm going to pause it right here. I got a whole lot more to say, but I'm going to pause right here and let Nurse Renee, she has a story to tell you, and I'm going to let her give you this story.
Okay, guys. So Nurse Jackie has provided a lot of information for you. And what I'm going to do is provide a medical proven case that is actually a medical case. So I'm going to give you guys a source that you can fact check what I'm saying. And then if you have any questions, just feel free to reach out to us and just ask me, and you can offer your rebuttal to what I'm about to say. So first things first, your body has an endocannabinoid system. What does that mean? That means that when you take synthetic drugs, meaning that drugs that are made in a lab or in another entity, they're made by someone. Your body does not have a way to combat that. So it can mess up your organs over time. Specific medications can mess up your organs over time. Your body has an endocannabinoid system in your brain and in your immune system. So when you consume cannabis, the way God set the plant up is to work with your body. So that's that. So that's why when you look up certain strains of cannabis, they actually work to help repair brain cells. It depends on the strain. It depends on, it depends on a lot of things, your health condition overall. But there are strains that work specifically to help regenerate brain cells, which until recent times we thought was impossible in the healthcare arena. But we're learning, more research is needed, but I'll give you an example. So there's a TED Talk, Dr. Alan Shackelford. His last name is spelled S as in Sam, Hackelford. Dr. Alan Shackelford is not a pediatric doctor, but he did receive his first pediatric patient. Her name is Charlotte. Charlotte had a condition, a genetic epilepsy condition. So she had a seizure disorder, and she was up to over 100 seizures a day. So her mom was desperate. She had read something where cannabis could possibly help her daughter. She reached out to Dr. Shackelford. Of course, after some convincing, he accepted her case. He worked with her, and he was able to get her seizures very low to none. So, she was 5 years old when she came to him. She had been having that seizure condition since 6 months. So he worked to help her get her seizures down from over 100 a day. So the FDA has approved dronabinol, Syndros is another word, and Marinol. Those are all generic names and brand names for what the FDA has approved that is specific to Dravet syndrome, which is that rare epileptic condition. So it actually is believed that it helps her brain enough to stop having those seizures. And we need the research to kind of see why. We know that it did, but now we just need to figure out how and how that actually worked. So that's where Jackie and I disagree, where cannabis actually helps to kill your brain cells. It is true, when you smoke cannabis, you are changing when you combust it, you changing the chemical compound of it. So it can offer maybe some not so favorable conditions when you smoke it. But there's also a guy, his name is Rick Simpson. You can look him up. He's believed that his methods of cannabis use actually helped him to heal his cancer. So that's been heavily debated. I don't think there's any scientific proof. It's only what Rick Simpson himself has said, and you can go on YouTube and just find videos. He's done interviews with different people, but his oil and his method of mixing the cannabis to help him deal with his cancer tumors and his pain and all of that, he believes that the cannabis actually healed his cancer. And this is over, I think he said 20 years ago is when he had cancer, and now he's been cancer free all this time. And the only thing different that he says he did was, and he actually smoked his cannabis. So look him up and you'll see 2 different cases where cannabis has been effective for these 2 different people, one older gentleman, one pediatric patient or child. Because again, we're nurses and we may use terms, and I want to keep it where it's very neutral and friendly. So pediatric is another word for kids. So those are 2 very different spectrums of how the cannabis actually helped the endocannabinoid system or worked with the endocannabinoid system. So that is why Jackie and I, of course, we disagree on, the effects of cannabis. So we would love to know what you guys think. And Jackie, if you have something that you wanted to add?
No, I just wanted just to everybody to take the information that we give and then just weigh the facts.
Yes.
And, do some research and stuff and look up and make sure that, before you ingest, before you eat, before you smoke, before whatever, however, make sure you're aware of what's going on with your body.
Yes.
And because what may help one person may harm you, and just because it helped in that area, it could still be destroying something in that same person in another area. So just do your homework and just take it from there.
Yeah. And I will offer something else. We're always taught, I know when I took CanSum, I'm going to always shout out Lolita because of her is where I got my information, my medical information as far as cannabis. CanSum, shout out to Lolita, Nurse Lolita. But she taught us that we're supposed to, especially if you're a beginner with cannabis, you're supposed to go low and slow. What does that mean? That means that you're supposed to take the smallest amount of cannabis, see how you feel, see how you feel, whatever you feel. So if you have pain, take your 1 milligram of CBD to maybe your 1 milligram of THC. And if you feel kind of like Jackie was saying, you're dizzy, or it makes you tired, or it makes you fatigued, or it makes you paranoid, then that's too strong for you, and you need to find out what strain that is, because maybe that strain is too strong for you. So it is not a one size fits all. Jackie is correct. It's not a one size fits all. Oh, I have this particular disease, and I'll just throw some diseases out there because I don't want you guys to have to guess. So I have a chronic pain condition from my arthritis, and I'm gonna take I'm just going to throw this out here. Green Kush, that's a strain. So that may work for my particular arthritis, but Jackie may take Green Kush.
No, Jackie's not.
See, this is why we love Jackie. So she may take that same strain for even the same condition, but it may work different with her. It may cause her to have all those previously mentioned side effects. So, of course, Jackie, being Jackie's and feeling the way she does, she's going to say, oh, nope, it's all the cannabis. It doesn't work. It doesn't work. It doesn't work. But that's not always true. We just have to find what works for you. So that is what, that's what the podcast is about. We just want to make sure that you guys have both sides, because wherever you are, we want to make sure we are giving you factual information that you can fact check for yourself and back up for yourself. And you're not just taking our word for it. Right. And we are not perfect. So if we say something that you don't agree with, you say, hey, but I found this over here. Please feel free to let us know, and we can always talk about it. But please believe we fact check before we come on. So you guys, nursing is the number one trusted profession. So that's for a reason. Absolutely. We have to fact check. So we wouldn't bring you out anything that would hurt you or intentionally steer you in another direction. That's why this is a welcoming environment. We welcome everybody's opinion. We can agree or disagree, or maybe we can just say, well, I'm on the fence, because both of those things make sense to me. And as you just keep listening and gathering information, eventually you will pick your side, and that's fine. We're here. So that was it.
Yeah. And so before we go, I just want to say this last thing about the THC. Mm-hmm. There was a study in New Zealand. Mm-hmm. They found that persistent marijuana use especially with the adolescents, that it was associated with a loss of an average of 6 or up to 8 IQ points by the time they became mid-adult. And those lost IQ points, they could never get those back. So that's a study that was found in New Zealand. You guys can look that up. Because they were talking about just the effects of the THC, and it was talking about the studies they did on certain animals that they tested it on. So think about this also. if you and when you do, especially if you're a smoker, make sure that there are no children around you, because that will have, not only will it have an impression on them to grow up to start it, but it can also, they're in a developmental states, brain-wise, it can have a detrimental effect on those babies. So.
And I won't disagree with that, because more research is definitely needed.
Yes.
So I can't in good conscience say, oh no, Jackie, that's absolutely incorrect. It can never happen, because we've already said that it affects people, depending on your genetic makeup, depending on your already previous history, as far as if you have some other ailments, already. But I will challenge that article, and the only thing that I will offer is another way to look at that. Did they study children that were the same age, that grew up in the same area, that ate the same food, that had the same DNA, or not the same DNA, but like the same genetic makeup? So did they do a particular population, or did they do a mixed group of population? And then what was the outcome for, say, the African American or the Caucasian or the Asian? Like, what, I just think that's a little bit broad.
Or biased, that she's saying.
Yeah,
guys, the brain is the brain, though. The brain is the brain. And I don't care where you live. The brain is the brain. So I love my Renee, but you guys, we're going to talk about this offline.
Yeah, we can
but
go
anyway,
back.
you do your research and come back with questions.
Yes.
And next episode, we will be talking about, do you think your insurance company should pay for your marijuana?
Absolutely.
For your medical marijuana. How about that one?
Yeah, that's good.
So we'll come back for our next episode. We'll be talking about that. Until then, thanks for joining and listening in. And don't forget that we talk.
Yes. So we'll see you guys soon.
Okay. Bye-bye for now.
Bye-bye.